Hi everyone, I'm Suhani Jalota, founder and CEO of Myna Mahila Foundation, an organization located in the Govandi slums in Mumbai, one of the hardest hit areas in the COVID-19 crisis. Since March, Myna Mahila's frontline worker team, led by Archana Jadhav, Archana Ambre and Vaishnavi Adhav, have been at the forefront, going door to door, trying to understand what are the challenges of our daily wages and our slum residents today. Since March, we've launched an 8-point plan to try to support these daily wagers and support these slum residents based on our findings through these surveys. We realized that ration and sanitary relief was the number one constraint that people really needed desperately. That's where we started with our first point of relief, and we're continuously doing so till date.
माझ्या मुलगी सिनियर KGला आहे. त्या लोकांनी माझ्या मुलीला मदत केल्याबद्दल थँक्यू सो मच.
We launched a women's helpline, and this helpline was meant for girls and women to be comfortably able to call us and tell us about any sort of domestic violence, sexual assault cases, or even ask us for relief or anything else that they might need. At 3, we started repurposing our machines in the Myna boutique that are used for stitching cloth bags and pad pouches to actually making face masks now that we've manufactured more than 10,000 of, and are going door to door again providing these to families that need them, as well as to police officers and other traffic policemen and officials who actually need them but still don't have access to them, including informal health providers as well, who had really shut down their businesses due to lack of PPE and gear to support them. At 4, we started doing some disease surveillance in urban slums, where we realized that a lot of the chemist shopkeepers were having a lot of information around the kinds of medicines that people were asking them for but didn't have a log of, and we could potentially use that to understand the prevalence of the disease in the slum communities, along with data that we were collecting on phone surveys, asking people about the symptoms around the disease. In addition to this, we were doing surveys with informal healthcare providers in the urban slums, trying to understand the types of cases that they were getting to try to map the hotspots in slum communities, for which we have very little data about anyhow. At 5, we started providing COVID sensitization and awareness around accurate information around COVID on call to all of our beneficiaries in thousands, and had a whole team of research fellows doing this, and we are continuously doing this till date. At 6, we converted most of our education and awareness programs that we were doing in groups and in person as web series that we were doing then through Zoom and through other social media channels. Our incredible team has been putting these up almost every week on various topics around COVID, as well as other women's health related topics that women need to know more about and prioritize. At 7, we've been doing COVID research, where we are essentially trying to understand how do we better provide messaging in a way that reduces the stigma around COVID and makes people comfortable in revealing their symptoms, and makes people comfortable in feeling as part of the community and taking the initiative to come up front and actually seek care and actually help each other and follow all of the public health norms by caring about themselves and their community. At 8, we've launched a Myna Mahila mobile health application to try to connect all of the girls that we had beneficiaries digitally to one another, as well as for us to be able to provide more accurate information on a more consistent basis to them around both their menstrual cycles as well as COVID-19. All of these ways have worked fantastically well, and we've realized so much more needs to be done. There's still many more ways in which we can be supporting our residents in our slum communities, and we really look forward to support from other NGOs and organizations as well, as we work in some of the most vulnerable and most affected communities in Mumbai, such as in Cheda Nagar, Jayambe Nagar, Govandi, the Mankhurd transit camps, and so many other transit camps that really don't have any other organizations supporting them. We have an incredible team doing this on the ground, and I really want to use this opportunity to also give a kudos to the entire team as well as to all the other organizations out there providing such important relief work around this time in Mumbai and all over the country and the world today. Thank you so much for listening, and we know that we've only started to get started on this front. We know that COVID and this pandemic and its after effects are here to stay. And we are prepared for that. So we would love to work together to try to make our impact even bigger and try to amplify all the work that we're doing on the ground together. Let's join hands and understand and know that periods don't stop during this pandemic, and that we need to provide as much support and impact as we can to all our beneficiaries. They're looking up to us, and it's our responsibility to be able to support them. Thank you.
Thank you.